Welcome to Chemical Safety for Environmental Services. Working in environmental services requires the use of various chemicals to keep the hospital environment clean and safe. This program provides information to help you use the chemicals in a safer manner. As an environmental services technician, you protect patients, their families, and staff members by keeping the environment clean and disinfected. Antimicrobial chemicals or disinfectants are used to kill harmful microorganisms that may cause infections and other illnesses. But these disinfectants are strong and can be harmful if not used correctly. Using these chemicals in the correct way will protect you and others. Every chemical you use comes with a safety data sheet, or SDS. Your trainer, supervisor, or manager can show you where these are kept in your facility. The SDS tells you what personal protective equipment, or PPE, you need to wear to handle the chemicals safely. Some chemicals require a certain type of PPE when mixing chemicals, or inserting a chemical container into a dispenser, or when using the chemical to clean and disinfect. For example, you may need gloves and eye protection when dispensing or mixing the chemical, and just gloves when cleaning and disinfecting. The SDS will tell you when you use the required PPE. The SDS will also tell you which type of PPE is required for each type of chemical. Be sure to wear the type of gloves, such as nitrile or reusable industrial gloves, as required by the SDS to protect yourself from harmful chemicals. Masks, eye protection, and face guards are also to be worn if required by the SDS. A mask will protect you from inhaling chemicals. A face guard will prevent you from chemical splashes, and eye protection, too, is required at times. Personal eyeglasses alone are not an appropriate substitution for PPE. There are also masks available to fit over your glasses. To keep yourself and others safe, you must know all about the chemicals you use. Use them only according to the manufacturer's recommendations. Make sure you read the label. Certain chemicals cannot be used in certain areas of the hospital due to their level of toxicity. For example, phenolics cannot be used in the NICU or nurseries, as they can cause serious harm to the babies. It is also important to know when and where to use the different chemicals. If the patient has Clostridium difficile, a chemical called a sporicidal must be used. This may be either a bleach or a peracetic acid. Be cautious when cleaning equipment. You must be aware of the proper way to clean the equipment and use only compatible disinfectants to clean. That is, the right chemical for the right equipment. The chemicals you use will come in different forms. Some will need to be mixed, some are hooked to a dispenser for correct dilution, and some are provided in a form that are ready to use. Regardless of the type of chemical and the method in which it is to be used, it is important to use chemicals as instructed. If instructions are not followed, the chemicals may either cause harm or not work correctly. Consider, for example, the use of bleach. If too much water is used to mix it, it will not kill C. diff. If it is too strong, it may damage surfaces or make you sick. Always check the expiration date when using a chemical disinfectant. It is unsafe to use expired chemicals because they may have become unstable and/or may no longer be an effective disinfectant. Ready-to-use chemicals come mixed by the manufacturer and are in different forms. They may come in liquid form in a bottle and do not require mixing, such as in a spray or pour-top bottle. They may also come in the form of wipes. Chemicals that are not ready to use are placed into a dispenser that automatically mixes the chemical with water, then dispenses the mixture into bottles. This type of chemical is usually poured over cloths and used to clean and disinfect. Always use the dispensing system to prepare chemicals properly and safely. Self-mixing or combining chemicals is very dangerous both to yourself and others. With the proper use of chemicals and PPE, you and others will be safe. As previously mentioned, ready-to-use chemicals come pre-mixed in either a spray or pour-top bottle or in the form of a wipe. Use the chemical as instructed by both the SDS and the product label. This will ensure that you will remain safe, and so will the patients. Use the proper PPE to protect yourself, and never mix cleaning products or chemicals together. Always follow training guidelines and instructions on labels for proper usage. While the ready-to-use chemicals are easy to use, they can be quite expensive and require more storage space. There is also more waste with these chemicals. Automated dilution and dispensing systems are most commonly used in the hospital setting. These are available for a variety of chemicals, including disinfectants, window cleaners, and floor cleaners. The chemical bottle is hooked to the automated dilution and dispensing system, and the system automatically dilutes the chemical with water. Always follow instructions for use as indicated on the labels and the SDS. EVS technicians need training on proper use of dilution and dispensing systems to ensure proper concentrations. If you are not sure whether you have been given the proper training, please check with your supervisor. When using the automated dilution and dispensing systems, you are required to test the concentration of the disinfectant periodically. Most manufacturers recommend test strips to validate the chemical concentration. One example of this is the test strip available to test quaternary ammonia, or QUATS. Usually, EVS supervisors will test the chemicals according to your facility's protocols. Remember that the chemicals used in the dispensers are concentrated. Always follow the instructions and make sure you are wearing proper PPE when dispensing and using. The instructions are different for every chemical. Make sure containers on the EVS cart are fully and correctly labeled. Chemicals must be dispensed and used individually. As an EVS technician, you will receive training on proper use of the chemicals and the dilution system. There are many advantages of the automated dispensing systems. When used correctly and according to instructions, these systems reduce skin exposure to harmful chemicals and potential of inhaling chemicals during the dilution process, and provide the correct dilution and disinfection solution. Other advantages are reduced waste and cost. Be safe, protect yourself, and follow instructions for use on labels. Federal regulations require users to follow instructions on disinfectant labels that usually include dilution for use, contact time, and shelf life, storage and material compatibility, safety measures for use and disposal. Remember, some disinfectants are ready to use, so no dilution is required. Other disinfections may be provided to your facility in a concentrate. If label includes instructions for manual mixing with water, it should provide details about the source. For example, clean water, how much water, and temperature of the water. Be safe, protect yourself, and follow label usage instructions. The label will indicate whether the product is to be used at full strength or requires dilution with a specific measurement of water at a specific strength for different requirements. Be safe, protect yourself, and follow label usage instructions. Most disinfection concentrates are liquid concentrates. However, some disinfectant concentrates are solid tablets that should be placed directly in water to dilute. Labels should indicate the specific amount of water to create the correct dilution for use. Do not add more tablets to the water than instructions indicate. Always use fresh water when mixing, and make sure the chemical is fresh from the bottle. Never remix the chemical with old water or solution because it may reduce the chemical's effectiveness and may help spread microorganisms. When disposing of the chemicals, always follow the label and the SDS. Some chemicals, especially when undiluted, may cause damage to the environment, and it is against the law to dump these in drains or regular garbage. If a chemical spill happens, it is very important to follow the instructions on the SDS to know how to contain and clean the chemical. Never clean up a chemical spill if you are not sure how to clean up the right way. If you are unsure about the proper cleanup, put a wet floor sign in place and remain in the area to prevent slip and falls. Contact a supervisor immediately. One EVS tech spilled an undiluted chemical in an EVS closet and did not know what to do. She left the room and did not notify her supervisor. When her coworkers entered the room, they thought it was water and they ended up with some small chemical burns. Although they had minimal injuries, the situation could have been totally avoided if the EVS tech was aware of the proper protocol or notified her supervisor. Some chemicals come with spill kits, a kit that contains ingredients to inactivate the spilled chemical. It is important to know the location and appropriate use of the spill kit. Chemical labels are now required to use pictograms, or images that contain hazard symbols for that specific product. Be sure you know what the label means. For example, the pictogram of fire means the chemical is flammable or can lead to a fire. The exclamation point means it may harm your skin. Remember to always pay attention to the expiration date to make sure the chemical is safe to use. Always make sure the bottle contains a label and the date prepared. Be aware of the first aid instructions on the usage label. Using different chemicals can be scary. As long as you are aware of the proper usage and wear the proper PPE, you will be safe. Remember, you are a valuable member of the EVS and infection prevention teams. Know all of the disinfectants and chemicals you are required to use in your department and their proper use and application. Not all chemical disinfectants are the same, and improper use may cause harm to both you and your patients. EVS managers and infection preventionists will provide information on the correct and proper disinfectants to use for various cleaning needs, such as isolation rooms. When in doubt, ask. Know where to find the safety data sheets and how to use them. Make sure the chemicals are clearly and properly labeled and not expired. Wear proper PPE. Be sure you report any adverse effects to your supervisor and employee health.